What's going on, everybody? This is Dr. Josh Funk. I am here with a very, very special episode of the Strength and Knowledge podcast with my first trio, right, between myself and two other people on our podcast. I am bringing you Dylan, one of the owners at Flight Performance, and Alex, who also works at Flight, but is an aspiring DPT student currently going through schooling at Simmons College. Welcome, Dylan and Alex.
Thanks for having us on, Josh.
Thank you.
Absolutely. Thanks for making time for me. So really just, we'll jump straight into it. We're fortunate enough to be bringing our R2P Academy team up to Boston and delivering our Blueprints course to the attendees that will be going through a rehab to performance progression. We'll be going over what we will call like checkpoints, phases, principles, progressions, all of these different buzzwords. But I'm curious, what has been your experience with the rehab to performance world to date, and where can we best make changes moving forward?
You want me to go first? Okay. I mean, I think I've had a kind of interesting array of experiences with it. I mean, so I started off at a personal training at a BSc, and, you know, with that, you're getting such a variety of clients, and, you know, but most of them are kind of middle-aged and a lot of them in pain. And anytime that, you know, and I was pretty green to the industry, so I didn't really have the answers for a lot of the issues that people were having, and didn't really know where to go with a lot of the training. So whenever they did end up seeing a PT or whatever it was, there just seemed to be a disconnect between, you know, the communication between me and the PT. And there also seemed to be this kind of disconnect for really, like, a lot of them just didn't have good experiences, I would say, to be honest. And then moving forward when we opened up Flight, and, you know, now we're really training a bigger mix. We're training, you know, probably 50-60% athletes, some, you know, from 12 to pretty high level and older, and, you know, up to 30, 40s. And then but general public, you see a lot of you're dealing with people in pain. You're always going to have these people, you know, a huge portion of our athletes are rugby players. So every weekend they're going to be banged up. So you have to have a place to start with them, no matter where they are in their spot. But then there has to be another person to lean on to go through that rehab process. So yeah, I mean, we've kind of seen it. I've seen it from a lot of different sides. And I think we're at the place where we're just trying to get as much knowledge as we can so that we can either be on the tail end of someone coming off a real surgery or something like that. And we can really meet them right where they are and transfer them where they need to go with their rehab process to perform the best and get back to being, you know, stronger than they were before. And then we also just want to learn as much stuff to be able to deal with people in pain and be able to still train as hard as we can and still be getting better, but working with them to not only just train around what they're doing, but also improve their issues and start to get them to feel better.
Yeah. I mean, if I chime in here, like it's a kind of a two-pronged issue with regards to rehab professionals. If I'm speaking specifically about my experience in PT school, and Alex, I'll let you elaborate here in a second, but we got a lot of information about injuries, and then ways in which to get people to baseline. But we didn't really focus a lot on more fitness or performance-oriented metrics that people are actually striving for. So I almost view it as like this massive disconnect where you've got, you know, the injury side of the spectrum, you've got baseline activity, and then if we're talking about GPP, I think that's a huge area where PTs can still focus on and ideally put people in a situation where they're achieving certain competencies, they're developing capacities before potentially getting more specific. Like if you are working with athletes that are, you know, 60% of the time, at some point they're going to get into more sports specific preparation after knocking off GPP. And as the older they get and their training age increases, they're in a situation where, GPP probably becomes less and less of a focus unless we get injured again. Then we need to go back into GPP building mode. And then if I'm speaking about my, experience, and granted it was limited, but I did personal training through graduate school. I spent some time doing small group training in more of like a Boyle type model. After school, I learned a ton, but a lot of people around me didn't really have an appreciation for managing variables, for appreciable metrics or manners in which to progress people based on things that they were either seeing or having things communicated to them. So this overlapping Venn diagram, so to speak, was almost very, very separated and siloed. But Alex, is that fair? I mean, I'm going to date myself here, but school about 10 years ago for me. So what's been your experience so far?
I think you both kind of hit the nail on the head there. And I'll take a sidestep here and say, I think I experienced this on both ends of it, because my original interest in PT was sort of prior to my own personal experiences with having PT. But, I've had 5 surgeries. I've had a couple ACLs. I had a hip surgery. And so I personally went through this rehab process, and I always felt like, okay, I'm done with my PT. I'm doing the leg press as best I can. I'm trying to play high level soccer at that point. And then I get out on the field and I'm like, I don't feel prepared. I don't feel like I know, I don't feel like I'm performing at my top level. And so that's what's been kind of interesting in my personal evolution, in that I saw what they were doing at Flight and how, Dylan and I have talked about this a lot, that they derive a lot of what they're learning about injury and training people from the fact that they're getting these people who are coming out of physical therapy who want to go back to high level sport. And there is this gap in those things. And I experienced that personally. And then, kind of on top of that, what you were talking about with school, you're totally right. We're given these tools of understanding, this is the pathology, and this is how to treat that pathology to get this person back to baseline. But there's not much discussion at all about, different ways of approaching that, but also in taking them one step further. And, can we as DPTs prepare athletes, or even prepare our general population, people who are going through these same things, to be then ready to be handed off to the strength and conditioning professionals or a personal trainer, or to be able to self-manage after that and know that they have a system that's well set up to get them to where they want to go, rather than what has been, at least in my personal experience and from what I've kind of seen from the people that we get that come to Flight, is this, all right, you're discharged, you're good, you're ready to go. And that is for sure not the case, but it's got to be it's a cognitive dissonance in that you're the person going through that and you're like, am I ready? I'm being told that I'm ready. Some system is telling me I'm ready to go. And now I don't know where to turn. So I think you're absolutely right. And it unfortunately hasn't evolved in the way that we're wanting it to, but I think we're going in the right direction.
If I could just jump in on that real quick. I would say that was a big thing with us too, is realizing once we had all these athletes that were banged up, how much of a gap there was in our knowledge base from what we learned in school. From a strength and conditioning stuff in school, you're learning, a lot on periodization, a lot on all the methods you're going to use, and some on exercise technique and all that. But you're not really understanding much about pain science and mechanisms driving pain, and the real progression from certain injuries, the dose response, and all these things that are really important for us to be able to actually, we're going to be dealing with these injuries. We're going to be dealing with these athletes that are going to come off this injury. And now where do we go with it? They're not just this healthy, athlete ready to go. We have to figure out how to work around it. And we didn't really get that knowledge in school.
And I think for you, the situation, right, I say you guys, but it's like as a strength coach, as a performance-oriented coach, even if we're talking personal trainers, unfortunately, you're put in a position where you're almost like the cleanup crew sometimes, where you're getting people that have done incomplete rehab, that are in a situation where baseline prerequisites, and if we get back to like a curriculum, have still been missed. At some point, we have to layer the pyramid and those elementary school competencies and capacities that need to be developed are potentially missed. And then people go into a small group environment where I'm not saying it's one size fits all, but certainly the amount of variance in your small group ideally would be less. But you're getting somebody that thinks they're good to go back to training when in all reality, like they if anything, need to probably work on some personal training with somebody, get some individualized attention, and make sure that subjectively they're doing things in a manner that you're comfortable with. Objectively, they're hitting certain benchmarks that you value and that you like to see. And then through that relationship, you're able to see a little bit more of the psychological profile of the individual, their overall confidence level, and whether or not they're ready outside of some of the preparedness. But if I speak to Springfield College, first of all, it seems like a freaking mecca of sports coach development. I mean, my old assistant coach, who's now the head coach at Ohio State for lacrosse, is a Springfield grad. And obviously we could go probably through a massive list of people who are pretty impactful in the profession. So you're special in that respect. I will speak to my time as an athlete at Ohio State. And I think this is where I got exposed to a little bit more of a continuum of care, where we had our team physician, who was actually Dr. Borchers, that was involved with the return to play. So he went from being more like lacrosse team physician, and now he's like the head guy for football now. But, I encountered him when I tore my labrum. I tore my rotator cuff, had the athletic trainer there. I had our team PT, Janine Ullman. She's now, assistant AD. And then strength coaches. Like I'm thinking like Andy Britton, who was there, Coach Troy, who now is over at Northwestern. Like getting to interact with all of these very, very high level professionals, seeing them communicate, seeing this more like seamless progression from me not being able to lift my arm to, communication and honestly informing me of risk sometimes going into a game of what I can probably expect to do well at and not do well at. And then seeing this progression of honestly what I'm just talking about with regards to competencies and developing capacity, and then getting to a point where my shoulder at the end of the season was good enough where I was like, God, I don't know if I want to get surgery. Like this has been great. And somebody went to me, hey, try a summer of just PT with no lacrosse. And here we are. So that was where Rehab to Perform at least kind of became an idea for me when I started to look at the marketplace in terms of what the consumer had access to. And, you're underwhelmed. I've been to generic run-of-the-mill PT and, hey, let's get back you to walk in and, feeling fine. And, oh, good, your arm, you can lift it overhead. All right, well, sounds good. But as we know, there's so much more. But for you, with regards to flight, and I think anybody who's in more of a fitness environment, what kind of things do you recommend to your coaches with regards to manipulation of variables for athletes who maybe are describing having discomfort or pain during a session?
Well, I mean, I think one thing that is unique about flight, we have definitely a community feel to it. There's definitely a camaraderie amongst the groups that are in there, but almost everybody has a personalized program. So that's one thing that is a little bit different than most performance facilities, especially, very different than like, group class, CrossFit kind of thing, whatever. But so everyone has personalized programs. So if they are in pain or something like that, one of the things that we really talk about with our model is, that first step is, all right, let's get the muscles that we need to be firing. Let's make sure there's the sensory feel to it. And let's make sure there's the motor competency too. So it's like, okay, what can we do if they're not feeling with the exercise that we're giving them? What constraints can we put on the exercise? What can we manipulate to make sure they're feeling the thing that we want them to feel? And then from there, once that's locked in, how can we progress that and start to take away some of these constraints and to let them, do it more full speed?
Yeah. And, I have to shamelessly plug this here in that, I wear many hats in my life. I am a certified athletic trainer. I'm a strength coach. And, most recently I'm a PT student. And so when I put on my DPT student hat, and I am absolutely floored by the anatomy knowledge and understanding of movement principles that the flight staff has, often more so than what I get at school. And I learn things every single day when, in essence, as the DPT student, I should be the movement expert. And so that's been kind of an interesting balance of putting that hat on and then taking that hat off. And you mentioned earlier, Josh, being the cleanup crew when you put that strength coach hat on. And truthfully, we love to pat ourselves on the back when we are able to manipulate variables to get our athletes out of pain when they're at flight. But we don't want to be the cleanup crew. And I think that's kind of that's really the big thing. And certainly, like, you and I, Josh, had connected quite a while ago. And the reason I was even interested in Rehab to Perform was through actually Zach Gabor, who was like, you gotta talk to this guy. And what you do is kind of the area of interest that we're looking at, which is how are we making this gap smaller? How are we getting closer to educating not only our patients, but we're educating a full industry? And how do we balance those two things to create a better collaboration between the two fields, rather than this, people feeling like they have to navigate it on their own, both as a patient, but also DPT students who are going through it, and ultimately, young professionals who don't know where to get the best information because there's such a push and pull.
I think if I had to piggyback on that and go really, really big picture here, but part of this is really, I think for me, just a concept surrounding business and conscious capitalism and wanting to be connected beyond the four walls of the operations in which our business is functioning under. So collaborating and finding ways to increase communication with various touch points of the people that we serve. So if somebody comes in to the PT facility, we want to know exactly where you're working out, who you're associated with, who's your coach. And those are opportunities for us to develop relationships that are only going to serve our mutual person, right, in a manner in which puts them in a position to be successful. But too often, and we hear about this word all the time, there are silos in which people focus strictly on what goes on within the four walls. There's either ego or potentially somebody's a little bit insecure, where putting themselves in a situation where the conversation is actually had is either something where there's going to be a barrier already because of because of ego, or there's just going to be just massive insecurity. Somebody goes into defensiveness mode, or they never even ask questions because they're so insecure that they don't want to sound unintelligent. So I see all of these different pieces pop up, and I do think it leads to more of this isolated, siloing effect, as opposed to people going out and saying, hey, I see that this kid practices with your club program. He trains with you over here. He's entering month 6 of his rehabilitation. We'd like him to start working with your group. Here's what they can do. Here's what they can't do. Hey, sport coach, they can do a dynamic warm-up. They can do indies at practice, and they could start to do linear conditioning with their team. And then you start to have this individual that starts to identify more as the athlete. They identify less as the broken human being. There's communication that ideally, continues to be had, that is more of a two-way street. And you put yourself in a situation where outcomes are just like literally going 10x compared to what they normally are. What are some things that, I would say are valued internally from a communication standpoint at Flight? And then tell me about some external initiatives as well.
Yeah. So, Josh, I love that you brought this up, because this is something that, unfortunately pre-COVID was pretty high on our priority list, and has been something that we've worked on, because I think the communication piece is a challenge. And full transparency, I have personally gone back and forth around, do I need to get my DPT to be successful in the arena that I want to be in? And on some level, the unfortunate answer is yes. I want to have that education. I want to have that flexibility and that credibility in the industry, but that has certainly been a barrier to communication. When we have someone who comes in and says, I have a previous shoulder injury, I've been treated at X PT clinic, and, I've worked with this doctor, we're on the phone. We're trying to make those connections. We're trying to get in with those people, not to take the person away from them, but to collaborate better. Like I said earlier, I learned a ton from the staff at Flight around, their pattern recognition and anatomy knowledge, but we can have that same conversation with the medical providers. And, I certainly can also do that as well. And we're trying to have that conversation. Okay, help me understand what you've done with this person so that I can better understand what I should do with this person, and vice versa. We're sharing the patient, we're sharing the athlete. And we've been really fortunate with Dan Pope over at Champion, who has absolutely been a partner with us in terms of we send our people to him, as much as we can. And he has been, the epitome of communication when it comes to, this is not a fight for power. We've developed an algorithm, and we've sat down extensively with our whole staff and talked about, okay, what is our algorithm for referral? How do we decide what's outside of our scope and what is within, our lane, in the sense that we're willing to try and do our best, but we also want to recognize that we need to be able to say, okay, I want to do what's right for you, and I want to be able to give you the right kind of attention. And if kind of what you talked about earlier in that group setting, we generally have a group setting. And so if someone needs that individualized attention that maybe we could help them if we could give it to them, we need to make sure we're making that referral and we're reaching out and we're sending them to PTs that we trust, because the perception of that athlete or that client is what matters to us. Like, we want them to get better. We want them to perceive that we are doing right by them, even if that means we have to send them out of our four walls, and that's okay with us.
Dylan, I know that, there's a lot of different ways that we could go there. As the owner, is there anything else you want to touch on there?
Well, I would think she really spoke perfectly to kind of that's like kind of our external output as far as communication goes. And I think that's something we've really been trying to develop, that network. So we feel really comfortable to kind of be able to, okay, this guy's kind of more of a specialist with this. Like, if he's having we have an athlete that's having a problem, let's send him there. And then internally, every staff meeting, weekly, where one of the main things we're talking about in our meeting is, have you talked to is there any client or athlete that's having any problems, anybody in pain, any issues that you've talked about, so that not only can we have the conversation as a staff as to how to deal with this, where to move forward, what we should do as far from a, whether it's a regression standpoint or just things we need to change in their program, or, maybe it's just a volume thing. Maybe we need to bring that down, but we have that conversation as a staff. But then it's also so that everyone who knows, when they see that person in the gym, we're going to have to be a little bit more careful, make sure they get a little bit more attention, make sure every movement is looking right, and you're making sure you're communicating with that client. Hey, like, or how is this feeling? Is this feeling right? Is this making sure that they're getting what they need to out of it to be moving in the right direction to get rid of that pain. So that's a huge thing with us, is just making sure everybody's on the same page with each person.
And I think, Dylan, you just kind of said this, but we coach as a team. We don't have an environment where if Dylan writes the program for this person, he's the only person that coaches that athlete or client. We coach as a team, which is, I think kind of speaks again to this relationship building, collaborative approach to, I don't own my clients. We do this together. We are building the Flight brand. We are all trying to get better. We all have our strengths and opportunities in terms of our coaching strategies and maybe what we're the best at in terms of pattern recognition and elite performance. But we try and do that internally so that when we step out of our four walls and we're going and trying to build these relationships with other providers, they're getting an entire team, and they're getting, a very aligned front where they don't have to worry that when we bring someone new on, they can't trust that person. And that is definitely something we spend quite a bit of time on building.
I think that's extremely important. And at least speaking from more of an ownership position, and Dylan, I'll let you kind of lead in here, but the word leaders create leaders, or phrase leaders create leaders, and then authenticity comes to mind when talking about modeling collaboration, modeling effective communication strategies that then your team sees. I know that this sometimes can be challenging in a world where it doesn't feel like everybody is leading by example. But from your side of the house, what are some things that you are mindful of each day as you're trying to create this company and really this environment and culture that is transformative?
Yeah. Yeah. I would
That's
say
a
the
deep
main
one.
thing.
I know, man.
It's a big one. It's a deep one.
Yeah.
It's everything.
Yeah.
Yeah. I mean, I think the biggest word that comes to mind for me with that, when I think of leadership, it's responsibility. You know, it's, and when I think about that from a clientele standpoint or an athlete, whatever, I'm thinking, you know, we have a responsibility to do everything right by this person to get the best outcome. And so that there is a responsibility with the way that you're coaching them, the way you're communicating with them, and the way that you're having your staff, if you're as an owner, having your staff, you know, communicate and interact. And so, yeah, I mean, I'm just the way, when I think about that, I just think that every day I'm trying to, you know, I'm never going to ask anybody on my staff to do something that I wouldn't do and that I'm not doing, you know, and making sure that that example is always set. And then from a training perspective, I mean, this is one of the, I think an issue in the industry is, you know, if physical therapists and strength coaches aren't training, aren't being healthy themselves, aren't following the same things that they're telling their clients to do, that's a responsibility too. You have a responsibility to be authentic and be truthful with, all right, if I'm going to ask you to be working on getting more sleep, like you're doing that yourself. If I'm going to ask you to try to get in here 4 days a week, like you're training 4 days a week yourself. And just, yeah, I mean, walking the walk, like you have to be in the trenches and actually, you know, do what you're talking about.
I think, like, for us, I mean, we have be greater than yesterday on the door as you leave. Everybody can see it. I actually have it on the back of the shirt that I have on underneath this hoodie. And when people see other professionals around them investing not just in their personal self, but their mental self, right? Because that's really what a lot of this is geared towards, right? How do we continually improve? But then it's something that just seeps into things that I think our clients and our patients pick up on. For us, I mean, continuing education could very, very easily be what I saw it to be in PT school, where I had CIs who were literally finding the online course for the weekend, signing in, and literally just letting the course run for the 8 hours, plugging in, and then doing a license renewal. And I mean, there's nothing more deflating probably to hear that when somebody's in earshot of you. Then, you know, you're like, man, well, this is what it's like, huh? 15 years from now, here I'm going to be doing the same thing. And like, I forgot who it was the other day, but sometimes it's so challenging for people once again to get past their ego and that admit that like 2 years ago I did something that wasn't great. Like, look at some of the stuff that I did, you know, even a year ago. Sometimes I'm like, oh, well, I don't do it like that anymore. But instead of being so defensive about what we did a year ago, we should kind of just appreciate the fact that, like, hey, we're in a better spot. And ideally, like, you know, Alex is picking up on the fact that you got better at something. So then she's like, oh, he's, you know, able to sit back and appreciate areas in which he needed to grow, and he kept growing. So now that's the kind of environment I want to be in. And those are the people that I want to be around. Alex, is that pretty accurate?
Like you wouldn't believe. I mean, I was actually thinking about this earlier today. It's like I have a crazy schedule with PT school and Zoom school right now, and
as you talk with your blue light glasses on. Right?
Oh yeah, I'm trying to preserve this perfect eyesight. But you know, between Dylan and Jared, I don't see two people that work harder. I mean, you know, they're up before the sun every day, and even through, I think it really, you know, our true colors and their true colors as owners and believing in this brand and believing in this business that they built showed through COVID in a really big way. And that I think a lot of places closed down, and it was sort of like, you know, we'll see you on the other side. And Dylan and Jared got together and they were like, we're going to make this work. We're going to figure out how to support our clients from home. And, you know, we got real tired of Zoom workouts very quickly, but they offered 4 workouts every day, one-on-one attention, like contacting, reaching out to all of our clients, making sure, like, are you okay? Do you have an option at home? Are there things that we can write for you? I don't care if you're using milk jugs. I don't care what you're using, but they took the opportunity to reinvest in their business in a way that they would have never had an opportunity to with the business being open 6 days a week. So they took this incredible challenge and said, all right, we got to figure this out because flight is that important and this culture is that important and our people are that important, both their employees as well as our clients. And I felt that. I still do.
Dylan, I would give you like a virtual pat on the back if I could, man. But here you go. I mean, but that's freaking awesome. I think when you're trying to redefine yourself during almost what could very easily be a lull in society, in our lives, I think for me, I continually thought of like Maslow's hierarchy, where we're in a situation where like the self-fulfillment piece is extremely challenging because people are focusing on like lower rungs of that hierarchy. So for you and your staff to really be, reinventing themselves, I think says a lot about you just as people and what you're actually committed towards, which is, continual self-improvement. It's not just lip service, right? But when you talk about flight and things like rewriting a training model, rewriting your internship curriculum, what are some things that you think are very, very important to you redefining a performance-focused gym and a fitness environment for not just these people, right? The training model that your people are going to receive in the curriculum, but the outcomes themselves.
I think what kind of changed in the curriculum and in the way even just the way we look at that is, I think when we first wrote our internship curriculum, we were trying to think of, and we had no experience with this, really trying to write out a training model. It's actually really difficult when you sit down and give it a shot. You think you have it in your head, but then when we realized that me and Jared were kind of on the same page with everything, so we never, we didn't have to write it out. When you have an intern, we're trying to think what's important. I think we wrote out more, method-based, like protocol-based kind of stuff. And as we went, we realized it's like what we really need to is give this coach, this intern, some perspective of what is the spectrum of coaching. What are the things that you really need to be good at to help people? What is if we're starting square one, I don't need you to know linear. I don't need you to know anything really about periodization. I need you to know how to communicate with somebody. What is the baseline? How do you look at somebody moving? What is competency in general? And how do we work towards, with every movement pattern that we train, getting them to be better? Like what do we need to give them to get better? And it's like starting with bigger principles and then working into the details towards the end. And then throughout this, throughout like an internship, the whole time, we're throwing them in the fire and having them actually get better through experience, which is one thing. But writing out that training model, we started to realize that it's like we need to hammer down principles and really work those out and write them out to every, detailed degree. And then when we're actually going to transfer this to someone else, we have just staples to go by, and then the details can go deeper as they understand the bigger picture of lens.
I think
how to look at it.
Yeah, if I piggyback up on that and talk internship curriculum and really just staff development itself, like you find out what matters to you and the people that you have on your team, and you try to find guardrails to support people making decisions that will align with those principles. And one of the things that was always challenging for me early on was continually just being of the mindset that when I didn't get the outcomes I want, whether or not it was outcomes in the people that were being served or the people serving the people that we're looking to serve, that it had to continue to come back to the way in which we provided the guardrails. The guardrails were too loose if we didn't get exactly what we wanted to. And that's where we get into just when I look at guardrails for rehab and progressions and things along those lines, you're talking about principles. You're talking about different phases. You're talking about manners of which to progress certain things, but it's more of a guardrails to decision-making, right? You narrow the guardrails to decision-making, appreciating that there's various roads to Rome, but we also don't want to make sure that we're allowing too much variability, especially to go down a path in which we know doesn't lead to those outcomes. So it's one of those things that we're still working on. We feel like we've done a lot to hone it. But if I get back to just what we're talking about a little bit and thinking about a training model, and one of the shortcomings of PT school, and something I think we do very, very, very well, but it's incorporating multiple areas in which we're working to make improvements in a dense program. So training density is something that I find myself continually having conversations with either new team members or new people into our internship experience in the, I guess, the light of the fact that you have a lot of PT schools and PT students that are doing like single set exercises with rest and just kind of blocked throughout the course. It's like, people make fun of PTs like, 3x10, 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 90 seconds rest, or hey, whenever the tech comes back and actually talks to me, So for us, just trying to find a way in which we are able to communicate the importance of training density, but how to best do it in a fashion in which is actually effective. Is that something that you've seen a lot of people have experience with? Is that something that you're communicating as well, especially knowing that we need to get these athletes from a volume standpoint they need to do more work? Any thoughts there?
Yeah, I think, there's just with all of our programs, that's like what we're kind of thinking. It's like I think Eric Cressy was kind of the first person that I read this about. It's just like, there should always be, these fillers of when, there's going to be your main exercise you're working hard on, the thing that you're really tracking, and that's, you're measuring success on. But then there always needs to be something there shouldn't be this standing around. We can get better at something else. Whatever, why not? And that's where I think, especially from a rehab perspective, when we're looking at people in pain, it's like, all right, we're doing something that maybe we're not involving the limb or the area that's in pain, and we're pushing that. And then now what's something that we can do that's at least driving us, whether it's some kind of structural core exercise, or whether it's some kind of mobility exercise, or some kind of just, lower intensity strengthening stability exercise for the area that is in pain. Why not take that time to try to focus on getting better and do some focused attention on something else as well?
Yeah, and that's something, if we don't do that in a PT environment, they're going to get a very, very acute spike in volume just by going to training. And that's where I think we fall short oftentimes, where we're doing such little work and little load that then they go just into an environment. Oh, hey, you're done with us. And we kick them to the curb, and they go two different directions, right? They go to performance coach and they go to sport coach, and it's just sharp increase. You either have potential re-tear, some kind of re-injury, or soft tissue injury. I hate to say it, but almost looking at like the NFL, where we had this very, very erratic offseason, very uncertain time period, no preseason football games. So we go through this, lower volume time period, less intensity, maybe intense sometimes, but less intense because, once again, we don't know when we need to peak. And then we jump out onto the field. Oh, game one. Good. Oh, well, you're ready for a full game and full intensity. No, that's just not how it works. So that's where I think that we have a lot more to learn from your world. And that's something that we just kind of been mindful of as well.
One thing that I think I actually I was listening to one of your podcasts, and you were talking about, which I love, is just that it's, even as physical therapists, you guys aren't looking at this as this broken patient and we're just addressing, this knee issue. We're just trying to get this person stronger and in better shape and just a healthier human. So yeah, we're going to do all the things that we need to do to address this injury, but we're also just going to try to get them to be more resilient for anything that they're going to come across. We don't want them to get deconditioned under your care. We want them to be in better condition. So then it's like, all right, now when they're out there, they're actually in a better place to be resilient and not go back to this, to where we are.
Dylan, real talk. Like, when I get somebody post-op, I'm on a mission to get them to a spot where I can bury them on a bike and bury them on a sled. Okay?
Yeah, exactly.
And that's me. I'm not like straight-faced, not even joking, right? We are going to get to fitness and conditioning where you're breathing hard in a safe manner as quickly as possible. So, yes, we're not going to allow them to go full blown, like, off the deep end with regards to deconditioning and losing all of these other variables, especially your engine. If density matters, volume matters, especially over time. If I've got you for, 1 month to potentially 9 months or whatever, I want to make sure that you are a fit individual by the time we're done, in addition to just anything else, knowing that if I have a fitter individual, right, you're harder to kill, man, right? If you can do a lot of work and you can do a lot of work for time, you're a harder to kill individual, and I feel comfortable I'm probably going to see you a lot less. So once again, I know that's overgeneralized, and some people might go, wow, that's kind of aggressive, but as safe as possible, as quickly as possible,
But Josh, honestly, it's like, sorry, no, I was just going to say, it's like, you don't want your athlete or your patient to be scared of their first day back in the gym. That should not be the way that we're, from a DPT perspective, discharging patients. And that's not how a strength coach wants to receive a patient. That's certainly not how a sport coach wants to receive their athlete back. And so, Josh, I think, it might be overgeneralized, but I think that's the direction we need to go. We need to not be afraid of building some of those qualities and handing off our patient in a way that they're ready for that next step.
I want to make sweating normal in physical therapy, right? If I had to pick one thing.
Make sweating cool again.
You are going to sweat every single time that you're in here, okay?
Let's make sweating cool again.
Yes. No, but seriously, like, I mean, if we are talking about things like a big picture health, we're talking about diabetes, we're talking about obesity, we're talking about heart disease, like, we're so much more than just injury focused. Like, we don't just have to narrow in with our binoculars on the fact that this person entered us with an injury and we're focusing on the injury. This is a freaking human being, like, we can talk sleep. Absolutely. We can talk basic nutrition. We can talk conditioning. If we get into things like where, hey, we can talk about all the different things that your Apple Watch does, or your Oura Ring, or your Whoop. So we're talking to this individual where health is the focus. And we've addressed so many different variables during your course of care, whether or not it was in session or outside, because we actually have email drip campaigns that kind of follow them along during their time with us, so that they're leaving us literally with a new baseline, an entirely new baseline. They don't just have a fully functional joint again or whatever. They're in the best shape regardless of their age. They're stronger from a relative strength standpoint. Their absolute strength ideally is potentially in a better situation as well. And their coordination of care in terms of the exit actually is there, as opposed to just saying, oh, hey, see ya, you graduated. Oh, you're going to flight? Okay, cool. Tell them I said hi.
Yeah. Well, and then how awesome is it if I'm the strength coach and well, how awesome is it for the client? But if, you get to this point where you've crushed them, they can do a hard workout on a sled and a bike and they're feeling pretty good. And how awesome is it for me to just be able to take where you got to them from a volume standpoint and just start them where they are, instead of either taking way too big of a spike or going below what you actually got them to a pretty high level. And now I'm kind of like going backwards as far as, where they are from a, maximal recoverable volume or whatever. It's like, that doesn't make sense. Let's keep going on this straight line. And if we have a good communication, that we can start, right where you are as far as movement patterns and volume and intensity,
Alex, anything to chime in there? Does that sound like PT school?
Not in the way. I mean, it sounds like the PT school I'd like to go to. No, I mean, so Josh, this is very timely because I'm going through cardiopulm right now, and it is, it's upsetting, and it's, in a lot of ways, it's disturbing that we have these patients that get to this place and no one's ever had a conversation with them about their overall health. And I respect cardiac therapists, and I respect that model of care, because it has to exist in a world where, our number one cause of mortality is heart disease. But if we can affect that change sooner as PTs, as strength coaches, as, providers in this person's community, these touch points that they're going through. And if they're getting it from multiple angles and we're having these conversations earlier, it's not such a shock down the road. And we're, hopefully we are reducing this, risk of all cause mortality. And this is the stuff I'm seeing in school right now. And I'm like, I want these people before they get there. I want them as young as I could possibly get them.
I agree. I mean, if you look at, just greater society right now, things like COVID, where I think, average amount of comorbidities that people have when passing is like 2.76 or something like that. It's something that we've got to find a way to become a grander part of the conversation. But hey, I'm going to put a bow on this thing and give you all an opportunity to really just allow people to connect with you. Do you mind giving, say, the social media handle, one or two of choice for you individually, and then information for Flight as well?
Yep. So our Instagram is going to be flight_performance. Our website is flightperformanceandfitness.com. And you want to follow me personally, my name is D Glutes. And Alex, you want to give your stuff?
Yeah, so my personal handle is AFHOOGZ, AF Hoogs. Last name Hubelbank. If you ever meet another one, they're related. But Josh, thank you so much for having us. We are pretty pumped to host you in a couple weeks.
I'm super excited to come see you guys. And thanks for your time. And for everybody listening, I will also get each of them on the podcast one-on-one sometime soon. Looking forward to that as well. But have a great weekend.
Looking forward to it.